Imagine for a moment that you are a nurse, wearing multiple layers of protective equipment, a gown, mask, gloves, and face shield, to enter a patient's room. Your 4-year-old patient has been placed on a breathing machine because this new virus, COVID-19, has made her unable to breathe on her own. You've heard that this virus has been causing deaths worldwide, yet you're obligated to care for this fragile child. It's what you've wanted to do your whole life. As you're caring for the patient, your face mask fogs as you breathe a little harder and a little faster than usual. Suddenly, you hear a whoosh of air. You've accidentally disconnected the patient from the breathing machine. You quickly put the pieces back together and realize that you've exposed yourself to this new deadly virus. Composing yourself long enough to make sure the patient's okay, you leave the room wondering if you'll get sick or bring the virus home to your loved ones. This is the story of my first of many shifts caring for patients diagnosed with COVID-19, and I am one of many who experienced the stress and fear of being a nurse during unprecedented times. The scale of the trauma caused by the COVID-19 pandemic is unlike anything we've seen in our lifetime. The impact on healthcare is ongoing. During the first 2 years of the pandemic, over 100,000 nurses left the workforce, citing stress and burnout as some of the causes. 610,000 more nurses plan to leave by 2027. We already know that not having enough nurses increases our rates of infections, errors, and patient deaths. If we don't identify the impact that the COVID-19 pandemic had on the nursing workforce, who will be there to safely take care of you or I in the times we need help the most? Researching this problem is critical. We currently don't know how resilience, burnout, and post-traumatic stress changed in nurses during the first years of the pandemic. My research aims to identify how these concepts changed and whether resilience and burnout had an impact on nurses' post-traumatic stress. Resilience is considered a positive adaptation to a traumatic event, while burnout is a phenomenon caused by prolonged stress at work, characterized by emotional exhaustion and disengagement. My research aims to identify why some nurses' mental health was more severely impacted than others. My goal is to use the findings of my research to inform healthcare leaders about the long-term impacts that the COVID-19 pandemic had on the nursing workforce, as well as inform better proactive measures and disaster training should another pandemic occur. The next time I walk into a patient's room covered head to toe in protective equipment to care for a patient who has an unknown virus, I deserve to feel empowered, not fearful. Thank you.